Hi, today we are going to be talking about eating disorder awareness and body positivity. Here are some stats from the National Eating Disorder Association. In a group of 20 girls monitored from ages 8 to 20, 5.2% had an eating disorder and 13.2% presented nonspecific symptoms. People aged 15 to 24 with anorexia have 10 times the risk of dying compared to their same age peers. By age 6, girls especially start expressing concerns about their own weight or shape. 40 to 60% of elementary school girls ages 6 to 12 are concerned about their weight or about becoming too fat. This concern endures through life. This will be a 5-episode series that will inform you about eating disorders, body positivity, and so much more. So why is this important? Eating disorders affect mental health. In this course, you will recognize that you're not alone, and you will learn how to manage your thoughts. You will also know how to help others and yourself, and you will learn about safety and resources. These are the topics for each video. What is an eating disorder? Symptoms, resources, social media, and the healthcare system. Each of these videos will have a lesson, an interview, a myth bust, and a mini quiz to see what you know at the end. So let's get started with today's lesson. Today, we are going to be going over the 6 main eating disorders. This isn't to say there aren't any more, these are just 6 that are the most commonly known. The first disorder is anorexia nervosa. This most commonly develops in young adults. People tend to view themselves as overweight, even if they are rapidly losing weight or are severely underweight. Here are some symptoms of anorexia nervosa. 1. Very restrictive eating patterns. 2. An intense fear of gaining weight. And 3. Obsessive tendencies. The American Society for Nutrition states that approximately 24 million people in the United States suffer from an eating disorder, according to the National Association of Anorexia Nervosa and Associated Disorders. Moreover, eating disorders are among the deadliest mental illnesses, second only to opioid addiction, resulting in approximately 10,200 deaths each year. Number 2. Bulimia nervosa. Symptoms include eating large amounts of food at a time and attempting to purge the food, either through over-exercising or forcibly throwing up. According to the National Eating Disorder Association, between 1.1% and 4.6% of females and 0.1% to 0.5% of males will develop bulimia. According to the Recovery Village, bulimia is 5 times more common in women than in men. Number 3. Binge eating disorder. Binge eating disorder is one of the most chronic illnesses in adolescence. Binge eating disorder is when an individual eats excessive amounts of food in very short periods of time. They can also conceal food, have guilt, be stressed, and do not exhibit purging behavior. Number 4. Pica disorder. Pica disorder is fairly uncommon in teens. Symptoms include craving non-food substances. This usually occurs alongside other disabilities, and it can lead to poison, infection, and internal injury. Number 5. Rumination disorder. Rumination is also fairly rare in teens, but it still is important to learn about. Symptoms include regurgitating food that they have chewed multiple times. This usually occurs 30 minutes after food intake and can lead to unhealthy weight loss and obsessive tendencies. And finally, number 6 is avoidant food intake disorder. Symptoms include poor eating due to a lack of interest or the shape, color, taste, or texture of the food. This can socially interfere with the child's development and leave them nutrient deficient. This is most common in infants and young children. It is extremely important to know how to recognize these symptoms, whether it's for yourself or another person. Eating disorders can be extremely dangerous. Today's interview is with high school student Aaron Marshall.
I did gymnastics I started when I was like 3, and then I did junior Olympic gymnastics until I was 14. Mm-hmm. So that was like a lot of exercise, like a lot every other day for 4 hours, competitions, like it kind of like was my whole life. I didn't go to a lot of birthday parties because I had practice. I was never allowed to like go ice skating or anything like that. That could like injure me or something. So that was like hard because it was like hard being a child like that, and then it was also hard because of like the amount of strain it put like on my body was really, really difficult.
Yeah.
And like there's such a high level of focus on your body in gymnastics. Like literally anything, they will like judge you. They'll say like this is not right, suck in, do this, point this.
Yeah.
Like that. So that was like really hard to have like a constant reminder of your body. And I would say when I was like 12, I started to be like very aware of like what I ate and like how I looked. I would say that was like the age that I started being really obsessive with social media also. I was really obsessive with like Instagram and posting and having the right picture and looking perfect in that and doing my hair. Like as a kid, I was always really like obsessed with my self-image because that's what I got like complimented on the most.
Yeah.
When I was little, I guess I was like a cute kid, or like I was naturally blonde, but whatever, and people would always be like, oh, you're so cute, you're so pretty, you're so tiny, whatever, and like only compliment me on my looks or my body. Yeah. So I was like very aware when it started to change because I would get less compliments on my body or my hair or my face or whatever if I had like acne or something. And so I was like started to be very aware, and I was like, okay, how do I get more praise about the stuff that I had been previously praised? Just slowly started restricting what I was eating. Like I'll be like, okay, so I worked out today so I can have this food, or I haven't eaten this in a while so I should eat this. And that was like, it was not very noticeable at first. Like in 8th grade and then summer going into 9th grade, I was very like, it was very little, very subtle. I would still eat whatever I wanted pretty much. And then in freshman year, I don't know if it was like the pressure of high school or whatever, I started like eating only like the shaped salads from Trader Joe's.
Oh yeah.
I started eating like pretty much only that at school, and then I did start to lose weight from that, and then I started slowly like eating less and less as much as I could, especially on the weekends. I would eat like less, like I would wake up late so I could eat less, stuff like that. And then I also like continued my obsession with working out. I would exercise and eat so little, and then I started to lose weight more and more, and then I started to move to like snacking instead of eating like proper meals and stuff like that. I actually started going to therapy, like I would say maybe 4 months before COVID started. So that was really good for me because I've always struggled with my mental health and depression and anxiety. Yeah, I started going to therapy, and she started like noticing me like, okay, well this isn't normal, and she referred me to a like specialist who specialized in eating disorders but was also a psychiatrist, and that's when I started getting my medication for like depression. But then I would also talk to her about my like struggles with body image and eating disorders, and that's when she referred me to a nutritionist who like actually started like looking at exactly what I was eating, exactly what I was doing, exactly how much I was exercising. And I think when I started to have to get better, that's when it got worse. Like it definitely got better. I mean, it definitely got worse before it got better.
Yeah.
Like I started restricting super heavily, working out obsessively. I couldn't like let myself go to sleep without doing my literally 3-hour long workout. My nutritionist was like, okay, like what we're doing right now isn't working, so I need to either send you to inpatient or you have to eat. My biggest like fear food like of all time was carbs, like any form of carbs, like anything. So she's like, or you have to eat a carb with your dinner tonight. And I was like, absolutely not. So I literally sat on the floor crying for like 3 hours, like would not eat it. And then finally I ate it because I didn't want to go to inpatient. I couldn't, like I take so many AP classes, like I had to pick between like literally, yeah. So I did pick like living, thankfully, instead of inpatient. I don't think recovery is something that ever like stops. I think it's something that's just like you get better at dealing with the thoughts you have, and you can be weight restored, but that's not recovered. So the conversation between athletes and the conversations between athletes and coaches are both extremely detrimental to athlete mental health and to athlete body image, because between peers, you're constantly compared, you're constantly competing against each other, you're constantly with each other, talking to each other about what you're doing, what you're eating, how much you're working out, how much you're not, stuff like that. And it's constant. It can get to a point where it's a competition, not just on like gymnastics, it's a competition for who's best. Yeah, better, whose looks the more Western beauty standard ideal. But then there's also a lot of negative talk from coaches to athletes. A lot of times they'll try and, especially at higher elite levels, they will control what you eat, they will control how much you eat, when you eat. They'll tell you things like, oh, like make sure you don't eat this because you don't want to look fat next Friday when you have a competition or whatever. You don't want to look this, you don't want to look that. I also did ballet for a long time, and that was really, really horrible when people would be like, I can see your lunch today, or suck your stomach in, you're too big, this, like that. I think getting praised as a child in gymnastics, especially for my body, was extremely detrimental. The best thing to do is to ask for professional help from your parents if you can, if you have the means. I know it's really not widely available to a lot of people, but I think that if you have the means to ask for professional help and to get professional help, that literally saved my life. Like, I would not be here without professional nutrition coaching or anything. Like, even if you just get a therapist, even if you just see like a counselor or someone every couple weeks and talk about your problems and get it out to someone who you don't know personally, that is like such a help to the recovery process for any mental illness. I really think that social media can be both a great and a horrible place for recovery, because there is definitely a lot of what we call like quasi-recovery, which is fake recovery basically, where you say you're recovered or you're recovering, but you're really not, because you're still letting a lot of the thoughts win over what you're doing. Like, something that really helps me when I'm struggling with anything with eating especially, is that when you're like literally dying, when you're like on your deathbed, like, and you think about your life, you're not going to want to remember so many years of wasted time that you spent every waking second thinking about food and your body and calorie intake or calorie expenditure or working out or what you're wearing. You're not going to want to spend X amount of years or months or days spending like time thinking about that. You want to think about all the people you love instead of how much you hated yourself, because what like a sad life that would be if you spent all of your time, even like I regret however many like 4 years I wasted in my eating disorder just staying in that same mindset of I hate myself, because it's so much better to love yourself. Like, it literally, like, it takes so much work, but it's so much better.
Now it is time for a myth bust. These will be in each episode. Their purpose is to combat eating disorder stereotypes and help reduce eating disorder stigma. Today's myth is only people who appear underweight can have an eating disorder. Anyone can have an eating disorder. ED takes many forms. Everyone has the ability to avoid and restrict food. Body dysmorphia plays a huge role in this as well. Body dysmorphia is the obsessive focus on a perceived flaw in appearance. Your size and weight do not matter. Unhealthy dieting is unhealthy dieting. It might look different per person, but eating disorders are equally as life-threatening for everyone. Mental health also plays a huge part. Eating disorders are recognized as a mental health condition. Eating disorders also are common alongside other disorders such as anxiety and depression. It is important to recognize that anyone can be affected by mental health issues. It is also important to note that mental health issues do not make you weak. We also need food to survive. Food provides the energy we need to perform bodily functions. Proteins, vitamins, and other nutrients are essential to the body and its well-being. This topic is widely researched. It's important to note that anyone can experience an eating disorder. Here are some takeaways from today's lesson. Please do your best to recognize that it's okay to feel a certain way. Don't assume anything, and definitely don't judge somebody else. You never know what they're going through. Use the knowledge that you learned here today to help yourself and others, and we'll cover that more in future videos. And that's the end of episode 1. Thank you so much for watching, and I hope you learned a lot. Visit www.nationaleatingdisorders.org for more information.
Created using Powtoon.